Hi friends, so now I would like to start a new topic today, which is Hypospadias and Epispadias. So first let me speak a few words about Hypospadias. So Hypospadias, what is Hypospadias? Hypo is below, spadias is opening. The opening is on the bottom, right? So if this is the penis, and this is the urethra. The urethral opening is on the bottom of the penis, okay? So generally the urethral opening should be at the tip of the penis, but here the urethral opening is at the bottom of the penis. So now, why is there an hypospadias? So at around 8th week of gestation, there is development of genital tubercle. So this is genital tubercle. So there is development of genital tubercle in both males and females. Genital tubercle forms. Okay. And this genital tubercle, which will grow cranially, it grows cranially towards head. Okay. In boys, if you see, there is dihydrotestosterone. This will activate formation of penis. Okay. So this is what generally the penis forms. Now, on the cross section, this is the urethral plate. Okay. The urethral plate invaginates to form a urethral groove. So this is the urethral groove. And now this urethral groove completely invaginates to form a penile urethra. Right? So by 17th week of gestation, so this is what generally happens. So this is penile urethra. So here, this is urethral plate. It invaginates to form urethral groove. This is lined by epithelial cells. Leading to penile urethra. Okay. In 14th week of gestation, these will, this is lined by epithelial cells, and this groove will invaginate, excuse me, and it forms penile urethra. Now by this penile urethra formation occurs by 14th week. Okay. By 17th week of gestation, this so right now what happened? So right now there is formation of this. This is the penile urethra, right? So now there are the ectodermal cells in the glans penis. In the glans penis, the ectodermal cells, these undergo canalization. So here ectodermal cells, that is the cells present here, this is called as glans penis. So the ectodermal cells of glans penis undergo canalization. Okay, and leads to penile canal. Now these both join together. So this penile canal and this both join together, leading to the penile canal and urethral canal meet to form urethra. So this is the main developmental feature in main development of formation of urethra. So now what happens in hypospadias? In hypospadias, both the urethras, that is the, if you see this is this one, the penile urethra and this penile canal, they don't beat. So in hypospadias, penile urethra and penile canal don't meet. So this leads to opening in bottom of penile shaft. So now, based on where the opening is, it is mainly divided into 4 types. So now, first, glandular. In this, the opening is at the glans. The second type of hyperplasia is corneal hyperplasia, where the meatus is present at the junction of glans penis and body of the penis. This is coronal hypospadias. It is placed at the junction of underside of penile shaft. Sorry, it is placed at the junction of, I'm at another place. Junction of glands and body of the penis. That is coronal. The third type is penile, where the opening is at the penile shaft. Okay, penile or penoscrotal. Where opening is on penile shaft. The final one is perineal. it is the most severe abnormality. The scrotum is bifid. So here the scrotum is bifid. So if you see, the scrotum here is bifid and urethra opens in its two halves. So if you see, this is the urethra, it comes and it opens like this. Okay, this is perineal. Where is my pen? Yeah. Where scrotum is bifid and urethra opens between two halves. Okay, now these are the major 4 varieties of hypospadias. So now what are the clinical features which are associated with this hypospadias? Clinical features. So the clinical features include, if you see, I will just draw one type of hypospadias, any type. So distal to this opening there is no urethra. So the first abnormality is absence of urethra and corpus spongiosum. Distal to abnormal urethral orifice. Okay. And the second one is bowing or heading of or bending of penis distal to abnormal urethral opening. So this is bent. So here, because of this abnormal urethral opening, this part becomes bent. Okay, that is chordae. So this is called as chordae. Chordae, that is bowing or bending of penis distal to abnormal urethral opening. Next, the next thing is urine soakage over the scrotum. So whenever there is urine over the scrotum, this will cause dermatitis and infection. It is associated with congenital anomalies. Next, treatment. There is a staged procedure. Number 1, at 1.5 years of age, there is surgical correction of chordae is done. Then 2, at 5 to 7 years, you can reconstruct the urethra, because the one which is there, that is the beyond the absence part of urethra, that urethra can be reconstructed. So reconstruction of urethra, it is done using propusal skin. Always urethra is reconstructed by propusal skin or scrotal skin. Okay, then perineal urethrostomy. It is done for dilatation, for diversion. In Dennis-Brown procedure is you do perineal ureterostomy plus reconstruction of urethra. Then this perineal ureterostomy is removed after some time, after speculated time. So that is Dennis-Brown procedure. And next, so this is there until the urethra is taken up. After some time, that is when urethra is taken up. Next, finally, you can do Dennis-Brown procedure. Maggie's repair. Makepeace repair. Makepeace repair. In Makepeace repair, we do meatal advancement glandular repair. So this is what hypospadias means. So these are the treatment options which are available for hypospadias. Generally, what are the indications of operation? Because we have many things, but when do we do these operation? These surgeries are done only and only when there is sexual problems due to this hypospadias. Only and only then for sexual improvement we do these surgeries. Okay, now coming to the next topic, which is Epispadias. Epispadias is here. It is similar to Hypospadias, but the urethra opens dorsally. But urethra opens dorsally. Opens on dorsum of penis. Right? So here, what is the commonest site? Is abdominopenile junction. This is associated with dorsal chordae, ectopic vesicae, urinary incontinence, and separated pubic bones. So these are the associations which may be seen. This is about hypospadias. So the treatment is, it's simple. Correction of incontinence. Correction of incontinence of urethra. And then you will have to divert the urethra. Urinary diversion. So these are about Epispadias and Hypospadias. So in our next class we will deal with the other conditions of urethra. Thank you guys for watching my videos. If you have any doubts, you can comment it in the comment section. If you feel something is inadequate in this video, even then you can comment it in the comment section. Thank you guys for watching my videos. Thank you.